Hello, we're here virtually with Sal Perla from Nashoba Valley Medical Center. Sal, we met a few weeks ago in person. We're meeting virtually only because it's easy. It's super easy to do. Definitely not because we're not meeting in person. We want to meet in person, but when we have a quick little catch up or whatnot, Zoom is a great alternative. And so we met in person a couple weeks ago to talk about, where things stand with COVID nowadays, for the businesses, for the community. What do they need to know? And so we wanted to meet and get a new update.
Absolutely, and I agree. I think Zoom and Teams is here to stay, and we actually just become more efficient, and we end up working more actually. So someone's winning out of this, right?
Someone is.
So why don't I just kind of start a little bit with some statistics of where we stand as of yesterday.
Perfect.
So my stats are going to be about Massachusetts, and I've dug down a little deeper to get to Middlesex County. So, so why don't we start? So since COVID started, we're at 1.68 million cases in Massachusetts, which is a big number. 23,614 deaths, which is a high mortality number as well. The Middlesex County had 319,000 cases and 4,697 deaths. So, the numbers still are significant, and now it's part of history too, right? So this is the plague of 2019 that lasted a few years. With that said, we are in a much better place than where we were last time. I think, Melissa, has it been a month or more than that?
I think it's been about a month.
Yeah. So as of yesterday, Massachusetts reported 1,852 positive patients. Now remember, that's a 3-day period because it's a Monday. So the running average is actually 904 positive cases per day across the Commonwealth, which is a very low number. Obviously, we want 0, right? But I mean, I think many people are saying we are approaching endemic, which means we're going to learn to live with this, and it's going to be like the flu or something seasonal that we're going to incorporate in our lives. Which I know no one wants a new endemic, but it's certainly better than a pandemic. So with that said, here at Nashoba Valley Medical Center, I'm happy to say we have 0 COVID patients in house.
That's fantastic.
So
that's great news.
Super excited. One, that's great news for our region, and it's great news for our staff because it is very, very difficult to care for a COVID patient. And it's very sad too, they can't have visitors. They're in a room with a door closed and we're communicating through glass. It's both physically and mentally draining on our team. So we're super happy about that. Last time we met, Omicron was just peaking or just beginning, I forget. But just a little bit of history on Omicron. So Omicron was first identified in South Africa on I think it was like my birthday, November 28th. So and remember that, Melissa, that's a very important date. Expect big gifts.
Absolutely, absolutely.
Yeah. So since then, Omicron has gone global very, very quickly. So a lot of questions are why. And basically, Omicron, in comparison to original COVID-19 or Delta, is much more contagious. And while that's scary, I caught it. I still don't know how I caught it. I actually tested positive the next day after I had my booster, which was really, a shame. So, but we've learned a lot with Omicron, and we've learned that it's super infectious and contagious. However, it's providing much milder symptoms. So people are typically recovering. Do you want to pause?
Milder symptoms if you have the vaccine, correct?
Correct. Correct. Yes, good
Sorry.
correction.
Yeah.
You know, Massachusetts is one of the highest vaccinated states, so it's very uncommon that we see unvaccinated people now. We also know that people that originally had COVID do have natural immunity, so they are able to fight off some of this and have a milder case as well. So,
Wonderful.
and I think we're still learning a lot more about natural immunity, you know, because one, it's harder to study, right? Who wants to sign up to catch COVID to study whether or not your immune system works? It's like going to the casino, right? You know, putting it all on black or red. So, but we are learning more, and it is definitely promising, showing that natural immunity does play an important role in fighting off the next variant. So with that said, symptoms are lasting with Omicron for fully vaccinated people about 3 to 5 days. That's it, which is great news. Certainly much better than 10 to 12. And you know, the symptoms are the same, with the exception of we're not seeing that really high fever, but you know, the runny nose and loss of smell or taste. And if anyone, you know, hopefully I can put a little humor in here, but that is definitely the diet. So when I caught it, I didn't know I was sick, and then I lost my smell, and then I lost my taste, and then I lost 10 pounds, and I was like, wow, like, you know, just when you can't taste anything, you're not hungry. So interesting.
Very. I need to try that. I definitely need to try that. I have gained the COVID weight. So
well, I can think of better ways than that.
Fair enough. Fair enough.
Yeah, I got a new app that I'm doing a home workout. I'll share with you. You'll love it.
Oh, good.
It's
Okay.
called Fit On. Really great thing. So with that said, you know, 3 to 5 days. So we've learned also to change our guidelines to come back to work, because we know that we now are far more educated than we were 2 years ago about when you are actually contagious. Before it was like, oh my God, you're going to be out of work for weeks and weeks, and you know, it's a huge stress for your employer and yourself. So now we know that the CDC's new guidelines for coming back to work is you can stop isolating at day 5 as long as your symptoms are improving. So if and loss of taste or smell, no, we're not talking about that. That could last weeks. Your diet could be extended months, but I think mine lasted 2 weeks.
Okay.
And slowly you'd get things back. But basically, you know, if you had a runny nose on day 1 and you had a fever of 104 on day 5, you're not improving. So you know, so it's progression, right? It's usually that stuffy nose, congestion. As you get better at day 5, what CDC recommends is, depending on what you do for work, just wear a mask for the next 5 days. And you know, don't go in you know, congregate settings, but you can go back to work. Just, you know, be cognizant, do your social distancing, and get, you know, move on with your life. I also find that, you know, activity when you have COVID, I walked. I happened to be in Florida, so I walked 4 miles in the morning, 4 miles at night. I kept myself active. I kept vertical. I was not going to let this beat me. And you know, sitting at home and doing nothing doesn't really help anything unless you have a fever and you need rest.
Right.
But if you've got a stuffy nose, you can get out there and walk, right? Go outside, social distance, and do that. So I think these new guidelines for coming back to work are definitely improving the economy as far as labor goes. And then, of course, if you can work remotely, work remotely.
Great.
Yeah. So that's kind of the update. Can I answer any questions, Melissa, that you think are going to come up from the community?
I don't have any questions off the top of my head, but definitely if we get any questions, we'll try to get the answers from you and share with folks as they come in.
Absolutely, and happy to continue this update. And hopefully, next time we meet, things will be even that much better.
Hopefully. It's warming up outside. Taste of Nashoba is coming up. Lots of great buzz things happening in the community. So I'm super excited.
Absolutely.
Well, thank you so much for joining us today and sharing with us this update. And we'll look forward to doing another update soon.
Sounds great. Thanks.